In this presentation, I'll be talking regarding blood pressure controlling medications. I think it's very important to know the action of antihypertensives, especially those who are working in critical care areas. Here is a simple and quick review of it. Here we go. So before going into the detail regarding the antihypertensives, let's see what do you mean by blood pressure. So blood pressure, that is equal to cardiac output into SVR, that is systemic vascular resistance. Means that is the product of blood pressure is the product of cardiac output and systemic vascular resistance. We'll come back to the systemic vascular resistance. And what is cardiac output? Is the amount of blood which is pumped by the heart in each minute is the cardiac output, and that is the product of heart rate and also the stroke volume. Heart rate, everybody knows, that is the number of beats in a minute, that is heart rate, and the stroke volume, the amount of blood which is pumped in each beat, that is the stroke volume. Then this SVR, that is a systemic vascular resistance, the resistance to the blood flow offered by all the systemic vasculature, that is called SVR, which has an influence in the TPR as well, that is the total peripheral resistance. Here you can see one equation, that is total peripheral resistance, which equals to systemic vascular resistance plus pulmonary vascular resistance, that is PVR. So systemic vascular resistance means we have two circulation, systemic circulation plus pulmonary circulation. The resistance offered by the vasculature in the systemic circulation, that is systemic vascular resistance, and the resistance by the vasculature in the pulmonary circulation, that is called PVR. So total peripheral resistance is the we can tell that is together, this SVR and PVR together we will call TPR. If anybody have any doubt in these terminologies, please go through my topic regarding the cardiac output. In that I have clearly explained regarding all these things, and please make use of it. So it's an easy way to remember the antihypertensive medicine, that is A, B, C and D. So in A, there will be two types will come, that is angiotensin converting enzyme ACE inhibitors and angiotensin 2 receptor blockers. One is converting enzymes and other one is receptor angiotensin 2 receptor blockers. So those medicines which ends in PRIL, that are known as angiotensin converting enzyme, that is captopril, perindopril, lisinopril, enalapril and quinapril. All these are the examples. And regarding this angiotensin 2 receptor blockers, those medicines that suffix with sartan, that is losartan, telmisartan, valsartan, omisartan, eprosartan, all these are angiotensin 2 receptor blockers. Next is B, that is for beta blockers. Beta blocker, that is ends in LOL, LOL. So mainly bisoprolol, labetalol, carvedilol, metoprolol and propranolol. Atenolol also there is. And this atenolol will, that is another name is tenormin. Okay, next we will see about the calcium channel blockers. These calcium channel blockers, the names of these medicines which ends in depins, mainly amlodepine, nicardepine, nifedipine, felodepine, isradipine. D, that is for diuretics. So that is called thiazides. Okay, so there are many diuretics. However, we look in terms of hypertension. That is only those diuretics which has effect on hypertension. That we are only looking for. So mainly thiazides. The examples are hydrochlorothiazide, chlorothiazide. Then other things which include thiazide is indapamide and metalazone also included in this thiazide diuretics. So now we know regarding the types of antihypertensives A, B, C, D, what it meant for and what other medications will come in each categories. Now we are going to see how each medication will affect the hypertension. How this medication influencing the blood pressure control, or how it will act on this blood pressure. Okay. So here is the important section. We will see how the angiotensin converting enzyme or the ACE inhibitors helping to control the BP. So this angiotensin converting enzymes stops the production of angiotensin 2 receptors. So inhibitors. ACE inhibitors means it inhibiting or preventing the action of angiotensin 2. So what is the action of angiotensin 2? Angiotensin 2 does a couple of things, like it increases the SVR. That means it increases the vasoconstriction. The next one is it increases the blood volume. What happened when it increases the systemic vascular resistance? It increases the BP. And what happened when the blood volume increases? It also increases the BP. But this angiotensin converting enzyme, it stops the production of angiotensin 2. So this vasoconstriction, and also the increase in the blood volume, that is not happening. So BP is decreasing. If you have any doubt in angiotensin converting enzyme or this ACE inhibitors and how's the action of all these things, just go through my renin angiotensin aldosterone system. There is a separate video. Then you can clearly identify the action of each. Okay. So next we will move to next one, that is angiotensin 2 receptors. So So here the angiotensin 2 receptor blockers, it blocks the the receptors. Okay, it blocks the receptors. What do you mean by the receptors? The receptors mean like you can see the receptors everywhere in the body, in the nose, eyes, face, in the blood vessels, everywhere you can see the receptors. What is the function of it? The main function of this is to detect the signals, and also which is sent to the brain as electrical impulses. So the brain will receive these electrical impulses, and the brain will act accordingly. So that's how the process will take place. So what happened here is angiotensin 2, it will block by the receptors. So what happened here? There will not be any vasoconstriction, and there will not be any increase in the blood volume. So what happened? The BP will be decreasing. As I mentioned in the earlier, like in the angiotensin 2 converting enzyme, there is no product. There will be preventing the angiotensin 2 formation. Here it is blocking the angiotensin 2. So the same mechanism or the same action. So next one is beta blockers. The beta blockers which stops the heart from beating so fast. So what happen if it stops from beating so fast? So heart rate decreases. So as you know, the cardiac output is a product of heart rate and the stroke volume. If the heart rate decreases, cardiac output decreases. So the BP is also decreases. So next one is calcium channel blocker. So what is the role of calcium here? So calcium, the use of calcium is it helps the heart and the artery to squeeze more strongly. That means it helps in the contractility of the heart. So the heart can push more blood. So that's how it can increase the that's how it increases the BP. So what does the calcium channel blockers? It blocks the calcium, so there will not be it prevents, it blocks the entering of the calcium into the heart and the artery. So what happens? There will not be any calcium, the arteries and the heart, it will be relaxed. So there will be not much strong contraction. So there will not be much contraction, there will not be much ejection of the blood. So the BP is getting decreased. So this is the last part, that is diuretics. So as I mentioned early in the introduction, all the diuretics we are not using to control the BP. Only the thiazide diuretics or the thiazide like diuretics we are using to control the BP. So what they do is they decreases the circulatory blood volume in the body via diuresis. So that's how the BP is getting decreased. So I hope everybody got an idea regarding the antihypertensive medicine. This is the end of the video. If you have any doubts, you can ask in the comment section. If I am able, I'll do it. And I'll be back with another interesting session. Till then, bye. Thank you for watching.